Where do you see Department of 2 visitors in there? All right.
Did you get checked in?
Yes.
What's your phone number?
715-891-4312.
I can't hear you.
4312.
4312. What's your name, please? Okay. Are you coming from home? What's going on?
My eyes.
Your eyes? What's going on with your eyes?
This is the 4th time I've been here. They say it's dermatitis, but it's something more serious.
Do you still have United Healthcare?
Yeah.
Did you want to opt in to receive text messages from eHealth?
Not really.
Is this accident related?
No. I may have been poisoned,
And then,
but it would have been a long time ago that I was poisoned. In August or something. But I don't know what brought on what I have. But
and if I can have you sign, it's for the conditions of service. So it says that we do bill your insurance. Anything your insurance doesn't cover, we have the right to bill you.
Yes.
And I'll have you sign now the keypad.
Sure.
You can verify that your name and date of birth is correct. Okay, I'll just put it.
I don't see very well. I don't. It's hard for me to read.
Okay. Here's your ID back. And then a nurse will be out in just a moment. You're running on the seat.
Examining? Yeah.
What's the cord?
Oh, my protection.
Huh?
My protection.
Okay, we're not allowed to have video.
Recording in here before, that's not true.
Okay.
I'm in really bad health. I really need help.
What are you here for, sir?
This is my fourth time here. I've yet to be examined by a doctor. My eyes and my eyelids, I have, they say I have dermatitis, but I think it's either shingles or it's untreated syphilis. My left arm has been numb for 4 months. I have migraines. I'm not doing very well.
You sick all last day, day before, and same thing the following.
Is it both of your eyes?
Huh?
Is it both of your eyes?
Yeah, but it's probably shingles because it burns and it wants to go away on this eye. So, I mean, I don't truly have it on the right side at all, and it wants to blink out here. This is the side that it's bad. This is the side that my arm is numb.
Okay.
And it's spread like I have it, you know, all over now.
All right, let's
And it's
get
gone from my
undressed.
eyes to around, and it's.
Okay, and how are you related, sir? Okay. Let's get you undressed and into a gown, okay? So we can get you examined by a doctor. When was the last time you were here, sir?
Month and a half ago, less than a month and a half ago. I'm stuck coming back in here they give me Prilosec, and it goes away at the end of the week. The flakiness is gone, but the dark spots are still there, and then it comes back in another week, and then I'm stuck like making it as long as I can till I come back in.
So your eyes are burning, correct?
You could look at them.
Okay, let me get these in here.
It's kind of hard to see. Sometimes it's obvious because it scabs up really bad, and then sometimes it's hard to see because I got like some lotion on it or something.
Did you have security? Did you let them know? Okay. Okay.
This is the arm that's numb that I don't feel.
Oh.
Pretty well.
Okay, I think I'm on the board.
Yeah. I just don't know what's better.
Thank you.
Left arm numbness, and what was the other thing you were saying? Your eyes, your
I'm
arm.
getting headaches really bad.
Headache.
Burning. It's spread to my groin.
Okay, we're gonna have to get you in a gown. What is it, a rash? I can't see a rash on your eyes.
I think you would have to look a little bit closer. What it does is it flakes up.
Okay.
It might not be that flaky right now, but there's dark spots. There's a dark spot here, there's a dark spot here.
Okay, and when did this all begin?
August.
I just have to let security know you have a camera filming.
Oh, you do, huh? We got security cameras in here and one for the phones. Can you see my waist? What does it look like to you?
It's being scanned.
Oh, I can see, yeah, it'll scab me.
So, okay. You could see too.
Oh,
It breaks and then it heals and it lifts. You can see the one eye is different from the other.
Did you see that?
The air gets right up in there and the soap gets right up in there. And,
Mr. Chesky, I'm Greg with Public Safety. Unfortunately, the policy we can't film inside the hospital.
Give me a copy of your policy.
I know the
Okay.
policy.
Leave me alone.
John, see, that's what your medical taken care of.
I'm sorry, I was treated really bad last time I was here. And never again. I recorded last time I was here, was perfectly fine with everybody. It's not the first time I've recorded in here.
Well, that's the hospital
I'm recording
policy.
for my own, I don't care to talk to you, sir. I care to talk to doctor or nurse.
Okay, I'll let the doctor know.
Yeah, you'll let the doctor know. What great medical care that you give people here. The last doctor, what did he say? Not quite an emergency, right? Well, you'd have to actually look at me to find that out.
Well, like,
That was Philip Alexander, and I wanna make a complaint about him.
so we're gonna have to get you into a hospital gown.
But I really don't feel right. I don't ever like going to the hospital, ever, for any reason. I think I'd rather just lay in bed and die.
Do you have suicidal thoughts?
No, but I'm gonna die if I don't get treatment. It's gonna be one way or the other. And what's worse, going through this, or I'll just lie in bed.
Have you traveled anywhere in the past month?
Yeah.
Have you fallen in the past 12 months? Do you have any problems with your gait, balance, or strength?
I'm not very strong right now. I don't have very much balance. I don't have my thinking is screwed up a little bit.
Do you use any assistive devices like walkers, wheelchairs,
I used to use a walker.
but now at the moment you don't?
I used to have a really bad back. I still do, but I take care of myself and I don't need a walker.
Let's see. In the past month, have you wished you were dead or wished you could go to sleep and not wake up?
No, I just wish not to be in pain. Not to have to go through agonies.
Have you actually had any thoughts of killing yourself?
No.
Okay.
Why are you asking these questions?
We asked everybody these
I
questions.
get asked.
I didn't.
Everybody
I
gets
didn't.
those.
I didn't get asked that last time.
I get
Yeah.
asked
Or the time before, or the time before.
Well, sir, it's right here. I don't know what the other nurses have done prior. I'm just doing what is asked of me for my job. Do you have any allergies to medication?
I'm allergic to dust.
Okay.
No allergy medications.
Okay. (150/83) is your blood pressure.
Last time I was here, they did it on this arm that's numb. They said my blood pressure is high.
Can you give me a number for your pain from 1 to 10?
I feel lightheaded. I feel buzzy all over my body. I have pain at certain times. But sometimes I don't really even feel much. I mean, I get migraines and stuff, but I'm not in very much pain right now. I feel dizzy.
You feel dizzy.
I feel, yeah, dizzy. I've had diarrhea for the past couple days.
So you can't give me a number for like a pain level.
I don't know how to describe what I'm feeling. It's not, because I've had severe back pain. And, I've had pain where, you know, you're on the floor screaming. And I'm obviously not at all pain, but I don't really, I mean, I can barely feel my left arm. I'm not really in a lot of pain or discomfort right now. I mean,
How much do you weigh?
the last time I weighed myself, I weighed 205 pounds.
No, not at the moment. 205, you said? How tall are you?
I'm 6 foot tall.
And what medications do you take every day?
Nothing. I've been taking aspirin and I've been taking the pink one.
A baby aspirin, is it you're taking?
No, an aspirin and a allergy. The pink allergy one will be at the start.
Benadryl?
Then,
Is that the one you're taking? And what are you taking that for?
to try to ease what's going on with me. This almost goes away with the Prilosec, but then it comes right back. And after the last time, I started taking aspirin, you know, trying to see if I could get strong enough to get over it, you know, whatever it was. But
Okay.
I'm not here to ask for pain pills or anything like that. I really, really, really want to find the medication that takes this away. I've been treated like that before, and I've never asked for any medication, and I don't want it.
So you've been taking aspirin and Benadryl every day?
Yeah.
For how long? Okay.
Look at you, really. But then I haven't had anything today. I didn't take anything yesterday. You know, I tried it for a week, and it's not taking it away, so I stopped. I tried to make it as long as I could before I came back in here.
Okay. Do you, so your only medical history is high cholesterol?
No, I have extensive medical history. Just I haven't been to the doctor in like 12 years because I haven't needed the doctor.
Okay.
My back was all messed up, and I was like 300 pounds.
Mm-hmm.
And I got a bunch of physical therapy, and then up in Wisconsin. Then I got denied for a simple test, and I was like, well, my health is good. I told the person off. I walked right out, and I never came back.
Okay. Do you smoke?
No, I don't smoke cigarettes.
Do you drink alcohol?
I drink alcohol every once in a while.
Okay. And do you do any recreational drugs?
No.
Is your vision changed?
My vision gets really blurry,
Mhm.
and it gets to the point where I can't read.
Okay.
So I mean, I've been able to drive and stuff, but reading stuff really is hard.
Well, I'm gonna give you a hospital gown you can change into, so the doctor can see that rash and everything. Okay?
Thank you.
Oh, good. Okay, thank you. All right, so you can change your clothes. I'll take this stuff off you. The opening goes in the back. Okay, and we'll be right back in with you, sir.
One. Don't let anyone kick you out. Stay with me.
Oh, yeah.
Okay, we're waiting for the doctors. They're switching shifts right now. He'll begin with you. And just to remind you, there is a sign on the door when you come in that there is no video or cameras allowed in here. We are getting the policies together, and you do not have permission to video me. I'm telling you that right now.
Permission by law. No.
I'm just letting you know.
I don't need your permission by law, and I've read the law.
Here's your pillow. Go ahead and sit back.
Get the policy, I'll read your policy.
Yeah, we're pulling them all up now for you. And I'll get
It's too big to have cameras in the hospital. But you see how bad they are.
You don't want you filming. I don't film that. Okay. Those are your experiences. I don't have those.
Thank you.
Well, yeah. No. The other ones, no, that would be the next.
There is no policy when I called on the marsh. She said it was a policy. I said I would like to see that. She said I would send it to you. And I'll get the answer. Probably never happened. Never got sent out.
I would be focused on getting more.
This is how you get it because they would just be like, "Titus, here you go. Here's another thing of prednisone for $14,000."
You have your experience.
Like we do this thing last time. The time before this, the time before last time, they had me lay down and put that stuff in my eyes. And that doctor was nice there. That's why I really wanted it. She felt compassionate and nice. But do some shit about that.
It's quiet. Just go over the phone prayers. So I was like, there are many people there. The emergency room is filled outside. The emergency room is all filled. Can't think of it. Crazy. Also, we're all gonna be-
I mean, this thing almost goes away. It's weird. It almost goes away like every day. And then I wake up in the morning and it's all stacked up. I don't have like eyeliders anymore. Not at all. My eyes tear up. It feels weird. Like I can feel literally feel my tear-ups.
You have something. He examines you, just so you know, more than your upper half, the upper just come outside the door. But I'll be right there. So,
I don't understand.
it's still what you want.
That doesn't bother me.
Well,
Beyond the point of being bothered by certain things.
that's true.
So beyond being bothered by, I don't see how people are wrong. I don't see how people are. I can walk around.
That's true. I don't care to go when we go on our job, something that everybody's got cameras on. I don't like that. That's what happened here.
That is people want to protect themselves.
Whatever. They have their reason. Okay, I have my reason of not liking it. And if they have the policy here, I don't have a problem with it myself.
The policy is for them to follow, not for them to follow.
I've had nothing on service.
Policy is not something I follow the law.
Okay.
I'm under the law, not under any policy.
And we need the paperwork ready for you on that now. I'm surprised that they're going to take care of that. They're in the law too, that they have to do.
The only reason this is happening right now is because, trust me,
It's not for them, it's because you've been in it before, you know that. You've got something
the
serious.
last doctor sat right there and said, this isn't quite an emergency, is it? He didn't look at
That's how he felt. So maybe he wasn't in there.
after he found out that I pay out of pocket for my prescriptions, he prescribed me a $200 bottle of paste.
Yeah.
The most passive aggressive fucking person you could possibly feel.
But then it's,
Now they're talking about something, so you don't want to hear it.
oh, that could be. I thought one guy, stuff with my guys, I want the homeowner shops, same thing. Okay. And all those, suicidal questions I get asked every time I go, not if it's the VA or private. And that's the shit that comes up on the screen. Sometimes everybody gets asked that.
All right, sir. So we pulled a copy of our policy. I'm not allowed to give this to you, but I can show it to you. And this is for photography, videotaping, audio taping, and other multimedia imaging
Okay.
for patient care and other purposes.
You would have to let me look at that for me to understand it.
The patients, family members, and other visitors are generally prohibited from creating multimedia imaging when there are staff, other patients, or visitors present. Public safety should be notified when these instances have been observed. Questions related to this should be directed to risk management.
Before I get help.
I'm sorry?
Let's go through this before I get help.
Well, we're
I'm
just,
not feeling that great, and for me to
Honey.
actually understand what's in that pamphlet, it would take me hours to read it. My eyes aren't very good.
So we're just asking not to videotape the medical personnel in here.
You're not on tape.
We had off.
And it's private. Well, I wish to protect myself. And I've had some very, very not nice experiences here.
But you have your father here.
I will get, that's why he's here.
Yes. Well, the doctor will be coming in next, and we'll see how he feels. If he's comfortable or
I
not.
hope he cares more about how I feel.
Well,
I'm
absolutely
the one
we
that
do.
needs medical attention, so.
Absolutely. We agree with you. But you have to respect our
I don't
position
feel
also.
Very good. And I don't.
Okay.
We gotta turn it off. That would be.
Yeah.
Pay attention to what I'm here for.
So it's much longer. So it probably is fine. I don't know what I'm talking about.
Neither do I.
Stand by this stuff.
Hey, my name's Dr. Chesson. How do you doing today?
Hi. Can it just be us? Could you?
Sure.
Yeah, that's fine.
So this happened in August, and I'm in Madison, and I'm enlivened and stuff. And the next morning, I get home, I wake up, and I feel like something's wrong.
This all started in August.
Yeah.
Okay.
This has been going on for a while.
The rash to the upper eyelids?
Yeah, and this gets really bad. Sometimes it almost looks like it goes away.
Yeah.
But then it scabs up really bad, holds the eyelid up. It's spreading. It's in my groin. I think I have like untreated shingles or untreated syphilis or something. They got it down as dermatitis because my story. I mean, I film. I go. I usually drive for like however many
Sure.
hours, and then I get there. I walk around for a long time,
Yeah.
and then I drive all the way home.
Hmm.
So my days are really long and stressful, and I have an aversion to sunscreen, and I was putting sunscreen on my face, and I think maybe that had something to do with it.
Okay.
Maybe that.
What type of sunscreen was it?
It's just spray on sunscreen, but I've broken out in a rash before from it. My arm's been numb. My left arm has been
Like
numb.
coming and going, or
Coming and going. It's not right now. It's
any
a
neck
little bit.
pain with that?
Yeah, it comes from the shoulder,
Yeah.
and then it feels like it pops the shoulder out. So I'm putting the shoulder back in
Okay.
all the time. I'm always going like this, or that's kind of minor. I have chest pains. I've had chest pains for years,
Mhm.
but
Do you have a primary care doctor that you go to?
no, I've been in relatively good health for like the last 12 years. I had a bad back, so I started going to see the doctor because of my back.
Okay.
And
Do they do any imaging of your neck? Do you know?
no,
Okay.
no, I've had an MRI of down there.
Your lower back area?
Yeah.
Yeah.
But I mean, they couldn't find anything. What I was fat, and I think what
You
would
lost a lot of
happen.
weight.
Yeah, I think it just squished everything till it popped out enough to touch the nerve,
Mm.
and it would just be
Yeah.
on the ground pain, like screaming.
So what can I do for you today specifically? What
They've
did you
been
come in with?
they've been giving me prednisone,
Mhm.
and it takes it away, but it comes right back after a week. So I mean, maybe
The courses of prednisone completely take it away?
well, it take the flakiness away, but then I got the dark spots, and then it comes right back in a week. So I'm on
Okay.
it for a week, and then in another week it comes right back.
Have you ever been referred to a dermatologist?
Uh, yeah, but this is my entire body.
No, I'm saying, have you seen a dermatologist? Because steroids is kind of like a temporary treatment, but really you need a biopsy and somebody to give you a definitive diagnosis. We can't do that in the ER.
Okay.
But a dermatologist would be able to take a skin sample and see what exactly is going on.
I got
Is this-
referred to a dermatologist. I went, and they wouldn't take my insurance. So,
Okay.
I mean, how I feel is I got untreated shingles or untreated syphilis or something.
So it's unlikely to be shingles. Shingles doesn't usually last beyond 5 weeks. This sounds like this has been going on. So shingle doesn't pop up and go away and pop up like that frequently.
Well, it's something worse.
So probably not shingles. And shingles only happens on like one side of the body in a dermatome.
This is mostly on the left side of my body. It links
Yeah.
up here, and it started on my back, and
Yeah.
it's a burning sensation.
Yeah.
So I have this burning
Yeah.
feeling and sensation, not just here, but
Yeah.
all over.
Yeah, it doesn't honestly sound like syphilis either.
I've been poisoned before. I might have been poisoned.
Poisoned by what do you suspect?
I'm a journalist, and I've pissed a lot of people off.
Okay.
I know for a fact that I was poisoned down at the Marlin bar. The cook came right out and told me we were going to have a bad night, and then I ended up in here.
Okay.
I couldn't drink water for 4 days. I
Yeah.
drank water.
Okay.
So, but I mean, I'm more interested in just getting this to stop. You know,
Let me, we got the current cold here. Let me see what's going on here. Any fevers? Like 100.4 or higher?
no,
No. Any
No.
cough, shortness of breath, like when I say like cough, sore throat, runny nose, anything like that?
no, I had a little
Like
bit of a
these
sniffle. Like
symptoms.
I'm really healthy. I exercise all the time.
Yeah, good. Do you use any creams in your skin at all?
I've been putting whatever I can get on this.
What is that? What are you using?
I was using cold sore stuff, and I was using whatever they gave me the last 3 times I was here.
Cold sore stuff, like what?
Uh, stuff I could get at the store for cold sore.
Like oral course, cold sore?
Well, for your lip, like a Carmex or for
Okay, okay. Yeah. Like a balm, like a lip balm or something.
and then really was putting chapstick on it for a while because it made it feel better. You know, it made it look like it wasn't there.
Yeah.
You know,
You ever tried Aquaphor?
I don't know what that is.
It's a similar product, but it's safe to be used around the eyes. So not all of those products that you're using are designed to be used near the eyes.
Yeah, they gave me drops put in my eyes here. They gave me cream for the outside. The last guy, he gave me a $200 bottle of cream, burnt the hell out of me.
Yeah.
But yeah, I haven't really stuck with any of that.
Okay.
This other stuff, it doesn't hurt as much, and it makes it look like it's not there. So, I mean, if I go out walking or something, I put it on.
Yeah. The chapstick sort of stuff,
Yeah.
or the Carmex stuff. Okay. All right. And that rash on the eyes, the upper eyelid, left side looks a little bit worse than the right.
Yeah,
That started in August or so.
It's actually gone away in this eye a couple times.
Yeah. How's your vision?
It gets blurry and it's hard to read.
Any eye pain?
Yeah.
Okay. Have you been to an ophthalmologist?
I haven't been to the eye doctor in so long. Last time I was at the eye doctor, physically had the flu. I'm just kind of scared to go. I mean, he visited me.
Yeah.
He was. I don't know how he managed not to like cough right in my face, but
I think so we can do, I mean, I'll definitely look at the rash. I think that you probably need some specialists as opposed to like, I'm happy to see you, I'm going to see you and treat you, but I'm an emergency doctor, so I'm trained. My training is not
I understand
specialized
you don't have
dermatitis or dermatological,
This
diseases.
is down here now too. I'm getting this like.
No, I'm just saying what I'm trying to say is that I think we need to involve some specialists because my training is more expertise in life-threatening diseases.
I even feel it burning on my leg, and you can't see anything on my leg.
Yeah.
So, and when I wash my leg like that, I can feel it just burn and burn and burn. But there's no rash. There's no nothing.
Any history of diabetes?
I could have diabetes. I could be eating too much sugar, I guess.
Can I see the rash in the groin area there?
Yeah.
I don't know if you want to step out, sir, or whatever you like to do.
Okay.
And again, happy to see you and treat whatever I can see, but I do think so, like an ophthalmologist or a dermatologist. So there's more than one dermatologist definitely in Fort Myers, Naples area, but I think that needs to be your next step is really finding somebody that can do a biopsy so that you can try to get some definitive care because we're putting band-aids on this. Even steroids, like multiple courses of steroids are not good for you.
I know.
They raise your blood pressure, they raise your blood glucose, they can
I
inhibit
tried
your
to
body.
go as long as I possibly could.
Let me see what you're. Are these painful?
No, not really, but I mean, if you're talking to a person that's been in a lot of pain before, I
Yeah.
react to pain.
Are you currently sexually active?
No. Screw it.
So this right here specifically. So not having any discharge at all?
No.
No. Anything on the scrotum that you noticed?
No.
Did you ever have like a lesion there that grew or something or no?
It looked just like this. It was flaky.
Okay.
And now it's going away because it seems like exercise kind of helps.
I'm just going
Also, go for a walk and
Okay. Anything on your back? Can you put that for me?
lesions and pimples on my back.
Okay. Overall, your skin looks pretty healthy on your back, though. Okay, you can go ahead and cover that up.
That's because I've been taking that pink that clears all of it up. Like some
All right, let me
taking the Benadryl like every day clears out some of my skin problems. Like I look a lot
close your
better.
eyes. Just want to see the skin here. You're not putting any hydrocortisone cream, are you?
What would that be?
Steroid cream on your skin there.
No, just what they prescribed
Let me
me
see that
here.
really quickly.
Just what they prescribed me here. So you can look at the prescribing the last 2 times.
Okay.
There was some drops that went right into the eye. And
Yeah.
The other 2 were creams.
Yeah, those drops in the eye, that's for like a corneal abrasion. So if you have like a scratch on the eye, it's one of the more excruciating things that somebody can suffer from.
And the eye pains, they come and go pretty fast. Like I can feel
That
like
doesn't
my
sound like a
eyeballs,
corneal abrasion.
it can feel like my eyeball's going to split into 3-4 pieces at one point, and then the next point I wake up, I actually feel fine.
Yeah.
Like I don't have any eye pain right now. I don't really feel
Are you
any
using
of it.
any eye drops right now?
No, I've just been putting the stuff.
The Carmex.
Yeah, to cover up mostly.
Okay, it's like a Carmex lip balm that you're putting in your
Yeah,
eye.
they actually have I have regular lip balm and then the stuff for cold sores.
Squeeze my hand. Squeeze. Squeeze really hard. Good. Can we touch in both sides?
Yeah.
Can we touch in here? Raise your arms up like this. Don't let me push down. Good. Or you can just put your arms like this. Don't let me pull out. Good. Now push out against me. Good. Perfect. Okay. Can we touch you down here?
Yeah.
And down here. Raise this leg up and hold it. Good. And down. This one up. Good. And down. You smile really big for me. Good. Raise your eyebrows up. Good. Close your eyes really, really tight. Perfect. You can open them now. You can be touching on both sides of your face here. Yeah. Follow my finger. Good. Good. How long have you had this eye prescription? Or the glasses that
For the longest time,
okay, so you haven't had that changed in quite a while.
I don't ever go see anyone unless I absolutely have to.
Okay.
So, I mean, just that way.
Yeah.
I don't do drugs. I'm not looking for drugs. I want to get this to go away because I had so many plans. I mean, this is crippling me.
The rash on specifically the dry, flaky skin above the eyes.
The whole thing. I mean, I just don't feel good.
Yeah.
And I walk all day. I'm a physical person.
Yeah.
So
Sure.
if I'm not up and outside in the morning, there's something wrong.
Yeah. Okay. I can do the dye in the eyes like you've had done before. It really doesn't sound like a corneal abrasion. It doesn't look anything like shingles to me.
Okay.
It's unlikely to be.
Could it be syphilis?
It doesn't look like syphilis either.
Can we try like an antibiotic?
It honestly doesn't look like an infection either. I was going to look and see if there's something different that we could safely put around the eyes.
I'm suffering.
No, I know. So all of these medications have side effects to them also. So, let me just go ahead and do some reading. I'll be right back. Okay.
All I know is that when Bob and I come in there, we get very good care. That's 30 years old.
So for some reason, when I walk into a place and I walk to the doctor's office, it's there's been a policy set on the water. You won't give out oxycodone or water medications.
Yeah.
So, and that was put up for me. So I've had this experience. This has been my experience. And sometimes like you have to drop the smugness. Just
No, that's not
leave me a little bit.
No, I have
no reason. I have no reason to make
you
sure.
don't take those drugs, neither do your mom or I take those drugs, and we never have. So it doesn't really pertain to us. They might have put them up there for us, but they don't pertain. Anyway, that's one good thing about the family. Nobody's on drugs. Any bad shit. All the stuff that's going on goes on out there. So,
Yesterday I laid back down at night and I felt so tired, like I could go to sleep, and I was like, oh God, I never have that. You know, it takes me so much to get to sleep. I have to walk all day, so it's, and I've been able to rest kind of for the last couple of days. You know, so that's weird. Like I almost got to the point where I didn't need to sleep.
Yeah, you can only go so long like that.
Yeah, but
So, because I know I don't always sleep. It builds up and then it goes.
I mean, if it keeps happening, it's not shingles, it's fucking syphilis or something. I mean,
Yeah, I didn't think it was shingles then. I've had shingles enough, and I've had doctors explain it to me enough. So, and, your mom just went through shingles. She just went through shingles. So, again, I've had shingles 2, 3 times.
this isn't shingles. The only reason that they're giving me is because it's on both sides. But they're not all. It's not like feelings on both sides.
So, you had some of the same symptoms. It seems like I do. And when I describe mine to a doctor, he tells me you have a pinch nerve. And that's why it runs down your neck, across your shoulders, down your arm to your hands. That's what I have. That's when I know my nerve is pinching back there badly. So, between that and I got neuropathy feet. They put me to my exercises on my back. And that's why you saw me last year walk like this. The more exercise I did, back exercise, the worse that my posture was. My mind was not going straight up at all.
You don't always have to walk. Like I go to exercises, I go to the circle in the middle, and then I do push-ups, and then I do balance exercises. I kind of march slowly.
Yeah.
Like one leg up, and then put down with the other leg up with the whole leg.
Yeah.
So I do different exercises that don't have anything to do with kind of walking.
Oh, okay. I could, yeah. Nobody was really, I didn't have
Walking is it's a task, and just trying to get done with it. You know what I'm saying? So you're trying to complete your walk rather than use your walk to make you feel good. When you could, you don't have to walk, you could stretch. You could
stretching.
till you walk enough, and then you'll have a problem. Like you'll have a problem with your shin, a problem with your knee.
No,
But if you do strengthening exercises and chair exercises and stuff like that, you can strengthen yourself. A lot of the times you're beating yourself up when you're walking. Yeah, it's good for me too. I do a lot of it. I mean, maybe I did get poisoned in medicine.
Or you could pick
It's
up
weird
something.
how it happened.
You could pick up
I mean, you could look at me on that video, I'm in perfect health.
Yeah.
I could blame it on maybe I poisoned myself with fucking sunscreen. I think that's what it is. And I think I'm just gonna have to deal with this for as long as I'm gonna have to deal with it until it wears off.
Yeah.
And then on top of that, I'm putting all other sorts of shit on my skin, and I just don't put shit on myself.
Well, you should put that stuff on your eyes. 'Cause, like you said, it's something for inside contact
He said
or something.
the steroid cream, don't put that on there.
Yeah, down that lip gloss or whatever else he said.
No, that was all right.
Oh,
I don't think he had a problem with that.
he said there's stuff called aqua.
I mean, I wouldn't have any eyelids left if I I mean, that's why this thing, that's why it's red. It looks like I've had a facelift on the side. You see, it comes up right there.
Yeah.
So it scabs and then it heals, but it heals up like that.
Yeah.
I literally have to take it and manipulate it back down so I can close my eye fully so I can wash my face.
Oh, okay. Yeah.
And I'm glad it's looking so good that people have to look that close. I mean, it makes me feel better. But
There's that stuff for your feet and eyes. He's using ointment $300, $400, $500, $600 too.
Mhm.
Out of pocket. He seems like he's getting like he's getting better.
we didn't talk about renovation.
Hmm?
I should have mentioned realization.
I think realization. You can recognize that. They get it right. And they get like breakout spots on their head, the patches. The guy had, they look kind of freaky. But that's real easy. You put your medication and close it up right now. They use the same medication as spray was using in 5 minutes. I don't know if that helped them or not.
The camera right there.
Yeah.
It's a policy. I think it feels safe with the camera. I don't know if that's just bullshit, but it just makes me feel good.
You know, you get looked at as far as getting bifocals jobs or you know, the drugstore, you could be stuck with a pair of reading glasses, inexpensive pair of reading glasses. So when you do want to read evening or whatever, you pop your reading glasses on. It's, you know, made up to relax your eyes more. Mom used to for years and years. You know, 10, 15 bucks a pair. Just go there and keep trying mine to find a pair that suits you.
So I'm gonna take a look at the eyes with that dye just to make sure there's nothing here.
One thing I forgot to mention, both my dad and my brother had rosacea, and it didn't, it was really bad. It didn't go away until they got that pill, that antibiotic pill.
Yeah,
So that
This-
might be what's.
really doesn't look like rosacea to me.
I
It looks,
know, but I got this redness that happens.
most likely this is something called blepharitis. That's what it looks like to me. So usually ophthalmology is the one to follow up with in that regard. I do have some ideas about some treatment that we can talk about. But one is an antibiotic pill. The other is an antibiotic ointment to put around the eyes. Okay. Let me just prepare this dye, and then we put one drop of a this is just a pain. It burns for a second, then takes away all the pain, and then I can test the eyes. All right, I'll be right back. It doesn't dilate. No, an ophthalmologist would do a dilated retinal exam. We can't do that in the emergency department.
Oh, okay. Just gotta follow up. Get it taken care of. We'll be back. Sure. If you have more options back there, that's what's there.
I'm scared to
I
death.
got 23 or what's
That's that's not even dilating.
I'm scared
Well,
to do it.
I don't think it's gonna be much more than, I'll put eye drops in my eyes to form. Yeah, this just happened to me a week ago.
I'm not scared.
That's all that matters.
Trust me.
Okay, Johnson.
I'm just.
And, I'm just trying to assure you about it. I don't have diet. The guys are this big. It takes forever for them to come back down. Put sunglasses on, and go outside, it helps. Not enough.
Yeah, you
I've got quite a few procedures.
But in the bill say with the negative pressure. Yeah, I wish that they just sold it like that. Yeah. Alright. So again, this doesn't look like syphilis to me, but I did check with our lab. We don't have a test to test for syphilis in the ER. The health department would be able to do that, or primary care could send it out. It's a send out lab. So something that needs to be collected and sent off to a special lab to test for it. It doesn't look like syphilis.
You can't do that. Right?
No, we don't. We can't do it physically in the emergency department. So, all right. You take this out. That's why I was saying maybe get a few specialists, definitely a primary care doctor that can do some like normal care for you.
I've tried to set up a primary, but
I could put in a referral for you
well, I got an appointment on the 15th.
with a primary doc. That'll go in a second. You have an appointment with a primary care doctor?
Some areas, it's extremely sensitive, especially.
This goes away shortly.
I will be around for it, so I'm going to have to cancel it. But I have an appointment for like May 15th or 16th.
Oh, you won't be able to make that appointment?
I won't be here.
Where will you be? This other drop does not have any pain at all. How long have you been trying to get in with a primary care doctor?
Since I've been coming here, since this has been going on, I haven't had too good of luck with doctors, and especially up north. So that's why I waited to come down here because I was up north when it happened. But when it broke out,
But you have an appointment scheduled in May.
May 16th, but I can't make it. I have to cancel it.
No, there's no way you can change your other.
No.
This one. Came back just a little bit.
Really healthy precedent.
Yeah, it's just good to have somebody that can kind of watch over your care throughout the year.
My
You know,
experience,
as opposed to like every time you come in,
Experience,
you meet somebody new. You know,
it's going in to see somebody trying to ask for a test, and then them trying to, well, you need this and this and this test. No, I want this test. Well, you can't have that test, and it's a cheap test. I ended up walking out of my last.
what test did you want? They weren't able to do.
I wanted them to scrape the lesion that was on my back.
You wanted them to scrape a lesion. Did you go to a dermatologist?
I was a nurse.
Look down. Look up. Look left. Look right. Look down. Look up. Look left. Look right. So I don't see any lesions on your eyes, which is great.
I think what I feel in my eyes might be just the skin flaking off and getting in my eyes.
Some of that
It feels
irritation.
like it's cut or something.
Yeah, I don't see any abrasions or scrapes or ulcerations or any sort of dendritic lesions. That's the word that we would be looking for. If it was herpes zoster.
When it happened, I felt it.
Yeah.
I felt it in my pineal gland. Like
Your pineal gland doesn't have nerves, so you
Yeah, but I
can't
felt
feel it.
I felt it. I know the brain doesn't have any nerves; you can't feel it. But this is the first time I've ever felt anything like that.
Yeah. No, I'm just saying, like,
wasn't-
you can't physically feel your pineal gland.
I know, but where I felt something there,
Okay, like a sensation that was in your inside of your
You
head.
know, when you get an ice cream headache.
Okay.
So I was at I was filming. I went up to a juice stand. I got a juice.
Yeah.
And I drank it. I couldn't finish it. I had to throw it away. It wasn't even that cold. It was just giving me
Sure.
an ice, but just really super bad.
Okay.
But the one thing that I remarked about it was I did have like a pain right here. It felt
So like a headache that was kind of behind that.
Yeah.
Okay. Yeah. So let's talk about the treatment for this. I would like to do some erythromycin antibiotic ointment that you could put on the eyelids. It's completely safe if it were to get into the eyes. It doesn't hurt them whatsoever. It's actually designed to do that also. So it would be okay as a salve to put in your eyes. The problem is it's going to make your vision a little bit blurry, so you don't want to do it before driving
Is
or
that
anything
something
like
that I
that.
already had?
I don't know. I can go back and look at it, but specifically on the skin. That's where I want you to put it.
Okay,
And then I'll give you some doxycycline.
because I might already have it if it was prescribed the first or second time.
So we give you some doxycycline also, which is an oral antibiotic that could help with this if there's an underlying infection there.
Okay.
Doxycycline does make you more sensitive in the sun, so you need to be really careful to kind of keep covered up. I would not put any sunscreen around the eyes,
I've been really sensitive to the sun.
and I wouldn't use any more of that Carmex that you're using on your eye area. You could use some Aquaphor. That would be okay to put, but I would try to get away from the eye as possible, as much as possible.
Okay.
And then you need to see an ophthalmologist. So if the one that I give you for whatever reason, I can't check what insurance they may take, so I can't verify that for you and ahead of time. But I would just ask them for a referral if they can't see you for whatever reason, because you need to get in to see an eye doctor, and then I'll give you a referral for. I'll look and see who you were referred to for dermatology, but I'll send you to a dermatologist also. Okay. All right, I'm going to go work on your paperwork. Okay.
Thank you.
So let's try those two options. Let's stay away from steroids this time, since you've had a few courses of steroids. And long-term steroids on the skin can cause hyperpigmentation, where it can get really dark permanently. So we don't like to do that either unless it's directed by a dermatologist.
Okay.
We don't typically recommend any steroid cream on face.
Yeah, I mean, it took it away, but those dark spots were still
For
there.
a short period of time.
At the end of the week, the dark
Absolutely.
spots were still there, and
Okay, all right, I'm going to work on your paperwork, sir. I hope you have some relief from this.
this is the best care I've had since I've been here. Thank you.
Thank you. All right.
So what I don't like about these things is that you go like that, and then it goes off. So it doesn't like when you do that, but no other live is like that. So you go on Instagram and you could put it however you want, but this thing I have to make sure it's, and then if I put it down, I have to make sure it's like that. If I go like that, it goes off. And really having that out, that kind of infuriates me and fascinates me at the same time. I mean, why is every other live the opposite of that? Are they tracking my every single movement on here? I think that's what it is. It's the GPS. So they know exactly where you are when you're live. That's why they don't like when you, because that messes up the GPS. I mean, I don't know that. A lot of things I can only make a speculation on. But,
Good to go?
Prescriptions are right there.
thank you.
The green paper.
Thanks for being nice to me. Yep, pretty white flowers on those trees. Most of them are gone. Last time I came out of here,